In late-onset Pompe disease, or LOPD, progressive weakness in the proximal trunk and pelvic muscles can significantly affect mobility. Progressive weakness also occurs in the diaphragm and other respiratory muscles, affecting a person's ability to breathe. Respiratory muscle weakness occurs in up to 80% of patients, with respiratory failure being the most common cause of death. Muscle weakness in the proximal muscles that enable you to move and the respiratory muscles that enable you to breathe is caused by the lysosomal accumulation of glycogen in the muscle cells. Because of pathogenic variants, the enzyme GAA that normally breaks down glycogen is missing or deficient. This buildup of glycogen in the lysosome of muscle cells causes the cells to swell and rupture, resulting in permanent damage. Weakness of the diaphragm is believed to be the main cause of respiratory dysfunction in LOPD and can begin early in the disease process, sometimes prior to obvious impairment in mobility. Decreased diaphragm strength contributes to reduced vital capacity, particularly when lying down. Performing both upright and supine pulmonary function tests can help identify early diaphragmatic weakness. Weakness in the diaphragm can also result in impaired cough and ineffective airway clearance, often leading to recurring respiratory infections. Onset of respiratory muscle weakness may be subtle at first, but actually can happen prior to limb muscle weakness. Early symptoms can mimic those of sleep disorders or of respiratory issues seen in other neuromuscular diseases, delaying proper diagnosis. Progression of respiratory disease can eventually lead to mechanical ventilation and acute respiratory failure. Recognition of early symptoms of diaphragmatic weakness is critical for earlier diagnosis and management. If you notice any signs of respiratory muscle weakness, consider testing for Pompe disease. If you yourself have, or if you care for someone with Pompe disease, it is important to monitor and manage your respiratory health.